start. So without further ado, I'm going to hand it off to Izzy. She's one of our wonderful therapists here at NOCD. So I'll just hand it over to you.
Awesome. Thank you so much. Appreciate the intro and appreciate the conversation about, what we're going to be talking about today. So exactly, just like Brenna said, we're going to be talking about rumination and time management. But first, I just want to introduce myself so you know who's talking to you and who's giving you some of this information, right? So my name is Izzy. I am a therapist specializing in OCD and ADHD. Um, and today we're going to be really diving into how these two conditions overlap, as well as just like how ruminating and time management together can make a lot of things like really difficult, right? So first things first, I wanted to talk a little bit about the overlap, wanted to talk a little bit about these things in general, right? ADHD and OCD are both disorders that can have a lot of difficulty with emotional dysregulation, right? There can be a lot of anxiety, there can be a lot of frustration that kind of goes with both of these, especially OCD, which is an anxiety disorder, right? And then there can also be some task paralysis, right? And so that's kind of, we're going to dip into that a little bit more later. But a basic overview is like with OCD, there can be a lot of avoidance that creates a lot of task paralysis, right? A lot of like ruminating, a lot of just like trying to figure things out versus like ADHD, there could be a lot of like executive dysfunction that makes it difficult to get things done and execute on tasks. But there's also a little bit of overlap too, right? So on the ADHD side, there's a little bit more impulsivity. And then on the OCD side, there's a little bit more of like really wanting to take control, right? And wanting to get certainty. And then with impulsivity sometimes can come some of that over control of OCD, right? And there's also like the distractibility that can go with ADHD, right? And if you know that distractibility is something that you struggle with ADHD, if you also struggle with OCD, then that can turn into like hyperfixation, like really needing to focus on something to make sure that you pay attention, make sure you get things done, right? So OCD and ADHD can sometimes seem like opposites, right? But they often feed off of each other, right? Um, so just to kind of give an example of that, right? A person who thinks that their strict routines are just like an ADHD structure of like, oh, I just need to do this, otherwise my ADHD is going to get in the way of the things that I need to do, right? Um, Sometimes what it can be is if you actually have OCD as well, is avoiding that feared outcome, right? If you don't follow those rules perfectly. So we're going to talk a lot about that today. So first I want to start with like, what is rumination, right? So rumination in OCD is not going to be the same as like spiraling thoughts that you see with ADHD, right? Rumination is really this compulsive drive for certainty. The way I describe it to some of my clients is like, you're trying to figure it out. You're trying to get certainty about something. You're really like thinking about something to try to like get that understanding, get that certainty. So it's very repetitive, it's purposeful, and it's really that distress driven, right? So you have this doubt and you're like, okay, I really, really need to figure this out or else, right? Or else something bad could happen versus like ADHD doesn't really have as much of that intensity, even though it can look very similar, right? It's more so like spontaneous, unfocused, a little bit of like wandering thought, a little bit more like daydreamy, but both can have that like negative impact when it comes to time management, right? So someone with ADHD who maybe like replays a conversation obsessively, not drifting, but urgently needing to make sure, like maybe that they don't offend someone, something they say, that might dip a little bit more into the OCD category rather than just exclusively being ADHD, right? Um, so let's take a look at like rumination with OCD versus procrastination with ADHD, right? So ADHD, oftentimes you can have difficulty with like time blindness, right? Like, oh, I have to get this task done. It's probably going to take me like 5, 10 minutes. And then all of a sudden, half an hour has passed, and you're like, oh my goodness, how did all of that time go, right? Or maybe you delay. Maybe you think, I don't really feel like getting up right now, but I know I'll have the motivation as soon as it hits 12 o'clock. So I'm just going to sit here. I'm going to scroll on my phone for a little bit. And then as soon as like 5 minutes pass, as soon as we hit 12 o'clock, then I'll do that. Right. So it's kind of just that like feeling of like, mm, let me procrastinate. Let me not do this. It's difficult to get started. Right. Versus OCD, it would sound a little bit more similar to like, okay, I really know I have to get started on this project, but what if I make a mistake? What if I don't do it correctly, right? What if something bad happens when I try to get started? What if because I have delayed or procrastinated, I'm going to get a bad grade on this project, right? So then someone with ADHD is going to start to maybe avoid doing that project because of that like fear, that doubt, that concern, right? So from an outside perspective, someone looking at you, whether you have ADHD, OCD, or both, is going to look at you and say, wow, they're just not getting their things done, right? But internally, that dialogue is going to look a lot different, right? And it might be a little bit of both, right? It might start off with some of that time blindness and delaying if you have ADHD and OCD, right? And it might be like, oh, I'll just get it done when like this time happens. And then it can turn into like, oh my God, I can't believe I didn't start this already. That's going to be horrible, right? That's going to mean something really, really terrible. So maybe like when we're looking at this, if someone is stuck in starting a task, the why matters a little bit, but from the outside perspective, it's going to look pretty similar, right? So an ADHD person, right, who keeps like maybe restarting tasks, not just because they forget, but because they're afraid of doing it wrong, might actually be a little of that OCD perfectionism that we're dipping into. So, one thing that I want to talk about when it comes to like how we're going to treat these things, now that we could see that there's a little bit of a distinctive difference, but externally it looks very similar. One of the ways that we treat OCD here at NOCD is through something called ERP, right? Exposure and response prevention, which is essentially okay, you're worried about this thing happening. We're going to do some exposure work. We're going to try to get us feeling some of that distress and then engage in the response prevention, which is essentially not doing compulsions, right? Not trying to do the things that would try to give us that relief. So in that case, I was just talking to y'all about, right? The fear would be, what if I do this project incorrectly, right? The compulsion would be avoidance, right? So what we would want to do is we would want to expose ourselves to doing the project, maybe making a mistake on the project, right? And the response prevention would be not avoiding it. But when we have OCD and ADHD, we really want to take a combined, customized care approach. A lot of the clients that I work with have ADHD, and there are some like slight differences we want to make to ERP. Just be mindful of some of those differences. Be mindful of how that can impact the work that we're doing, right? So we really want to adapt that ERP for our ADHD brains, right? So we want the exposures that we do, we want the work that we do to be a little bit shorter, right? We want it to be more structured and more flexible, which might seem a little bit confusing to be both structured and flexible. But what I mean by that is like structured support for doing the work that we're going to do, right? Making sure that we are, messaging on my ends, right? To make sure that you have that support of like, hey, reminder, this is what we were going to be working on. This is what we were going to be practicing. We actually have a feature here where I can send a message at a specific time. And a lot of my clients love that because some of them are like, you know what? I'm just not going to do it over the weekend. I'm going to forget. It's just not going to happen. And I'm like, okay, fair enough. Totally. I appreciate that information. I appreciate that knowledge, right? I'll have it sent to you on Monday. So that way when it actually matters after the weekend has happened, after you have completely forgotten about the things that we've talked about, not because you don't care about it, but because you have other things that you're focusing on, right? Having that structured approach actually makes it so that my clients who have both OCD and ADHD will get that reminder and they will actually practice the exposures that we're working on, right? And flexibility, one of the things that I think is so important is having exposures that you can really do anywhere, right? Making sure that you can do it in any place at any time. So that way, when you do remember it, you can do it right then and there, right? So that's what I mean by short, structured, and flexible. I had a client who was really having a lot of difficulty sticking to ERP, super motivated, really wanted to do it, really wanted to do the work. He knew it worked. He knew it would be helpful. He saw it in sessions. He just, for the life of him, could not remember to do the sessions, do the exposure work outside of session, right? So we broke it down a little bit more. We made it a little bit more structured. We made it so that he would get those reminders sent to him between sessions. So it just made it a little bit easier for him to actually do the work, right? And I think that's something that's so important for anytime anyone has different mental health disorders that are kind of overlapping, but definitely especially for ADHD, because you want to do the work, you want to make progress, you want things to get better. Sometimes you just need a little bit of extra support, right? And having that extra support, he really began to thrive and really began to be able to do the work here. So I think the other thing with that is, like, I mentioned this in the last webinar that we did as well, but like the use of fidgets, I think can be really, really helpful. And one of the things that I do when I first start noticing one of my clients who I'm meeting for OCD is fidgeting a little bit or like doing something that's a little self-soothing. We talk about ADHD. We talk about the potential of like, okay, are we fidgeting because we're anxious and we're doing something that's self-soothing? Or are we fidgeting, are we stimulation seeking because we really want to focus and we are going to have a lot of difficulty focusing if we don't have something to occupy our hands, right? So with an OCD client where it is more like emotional, kind of like wanting to have that anxiety relief, we're not going to want to be fidgeting. We're not going to be wanting to use any of those like stimulation tools, because what that actually is distraction, and distraction is another way of saying avoidance when it comes to the kind of work that we're going to do, right? So we wouldn't want to do it if it's just OCD. However, understanding how ADHD interacts with OCD can be really important, because we can recognize, like, no, if I do not give you a fidget or we do not allow the use of the fidget during the session, you are going to get distracted and you're not going to be able to sit there and do the exposure exercise, because you're going to be looking at the picture, the exposure of, let's say, someone puking, right, as a potential exposure. And you are just going to be thinking, okay, like I see this is distressing, but also thinking about, okay, when is the last time this happened to me? And what else is happening? Actually, the last time this happened to me was when I was at a theme park. And yeah, roller coasters are really fun. I haven't been on a roller coaster in a long time, because the last time I was on a roller coaster, I got really scared. I was going to puke because I felt nauseous. And yes, this could sound also very similar to rumination, but it also could be like, really, you want to do the exposure, you want to focus on it, but it's just very difficult without that fidget, without that stimulation, right? So supporting ADHD doesn't weaken ERP, it actually just makes it better, right? Um, so when it comes to like rumination in general and time management, right? We really want to kind of look at how ruminating in general can also have a very negative impact when it comes to time management, right? So oftentimes what I hear from my clients is that, I don't really know what happened. I had this fear, I had this doubt pop into my brain, and then I just spent hours on it. I call it going down the rabbit hole, right? So maybe you start with a what if doubt of like, oh, okay, like what if my friend is mad at me? Okay, we start with reassurance. No, my friend's probably not mad at me. Everything is all good. Everything's fine. And then OCD comes in and says, yeah, but the last text that they sent you had like a period at the end of the sentence. So they could be mad at you. And it's like, okay, I guess it's possible they could be mad at me. Let me try to figure it out. Let me try to make sure that they're actually not mad at me, right? And so with OCD, what you're going to do is you're going to spend a lot of time thinking about that interaction, thinking about your past interactions with this friend, really trying to understand, like, okay, are they upset with me? Are they not upset with me? What are those things going on, right? And then let's say when you had this thought, you were sitting down to like write an essay for school or something like that, or sitting down at work to try to like get some things done. And all of a sudden, because this feels so real, because this feels like so pressing, so important, you're actually spending a lot of time just thinking about that problem, trying to solve it. And one of the things that I talk about my clients with this is like, okay, but you're trying to solve a possible problem, not an actual problem that's going on right now, right? So you just spent a couple of hours trying to figure something out. That sure, it might be true. It could be possible that your friend is mad with you, but they haven't actually said to you, "Hey, I'm upset with you," right? So all of this ruminating, all of this problem solving that you've just done internally to figure out if they're mad at you might be all for nothing, right? So that could really genuinely be just time wasted spent solving a problem that we just don't know if it's going to happen, right? Versus, like I was saying a little bit earlier with time management and ADHD, sometimes you just get excited about something else. Sometimes you get really fixated on something, and it might sound very similar to that problem solving piece of like, I wonder what penguins eat, right? Like, what do they eat? What's their favorite kind of fish that they eat? And then you go down a different kind of rabbit hole with ADHD of like, let me look that up. That's really interesting. I wonder if like all penguins are like pescatarians and they all eat fish or something like that, right? And then you might spend a couple hours thinking about that. That also might be some time wasted, right? Because maybe the thing that you were sitting down to like write had nothing to do with penguins. That just kind of popped into your head as you were doing something. And you might be solving something that really doesn't need to be solved either. But the difference with the OCD versus the ADHD is really that like fear driven, doubt driven, trying to search, trying to figure it out. Um, and they can overlap sometimes, right? Like maybe with the ADHD, you are thinking, is my friend mad at me? Are they upset with me? And that might start you down the path of like thinking about the friendship in general, right? And maybe not like in a fear doubt way, but just thinking like, yeah, that is like a really good friendship. I like talking to that person. I like hanging out with that person. I like doing things. Oh, remember that time that we went on that skiing trip? Wow, that was really fun. That was a good time, right? Um, but it sounds a little bit different because it doesn't have that fear-based component that the OCD is really going to have, that intense doubt slash drive to like figure something out. But then it can be a perfect combination when you've got both of those things of like really getting distracted when you're trying to figure something out and having difficulty managing your time, and then it feels so stimulating to focus on what OCD wants you to focus on because it's that fear, it's that doubt, and it feels like, okay, this is really important. I really need to get this done. I call ruminating on what OCD wants you to ruminate on essentially like arguing with a conspiracy theorist, right? At no point in time is OCD ever going to give up and let up and say, you know what? You ruminated enough. You did good. You figured this thing out. It's always going to say, like, no, but this could be possible. This could happen. This is true, right? And so ruminating and engaging with OCD is really only going to keep you stuck in that time loop of just trying to figure it out and trying to figure it out and trying to figure it out. So let's see. Brenna, do we have any like questions popping through just yet?
Yes, we can get started if that's great.
Yeah.
For sure. Yeah. As a reminder, there's a Q&A box and we're going to get started into Q&A time. So any questions that you have about anything that she's talking about, feel free to ask. This is your time. And we love how this turns into a conversation. And yeah, so how about with that being said, let's go to one of the questions. So it says, I often have high energy days where I'm using good techniques, followed by a low energy day, poor time management, feeling low, going down rabbit holes. What can I do to manage this?
Mm-hmm. Totally good question. Um, Let me see. Just writing it down so I don't forget the content of the question. I mean, that's also like just part of the paradox that is OCD, right? Is like you're having good days, you're motivated, you're high energy, right? You're doing the things that work for you, you're making sure you're like getting things done. And as soon as your energy hits a low point, OCD is like, we're not doing the things that are right? We're not getting the things done that we need to get done. And then because you have lower energy, because you are not doing things in the routine structure that like either OCD or ADHD warrants for you. OCD tells you you have to do, ADHD says this will help us, right? OCD is like, well, you have to pick it up, like you have to do more. And then whether or not you actually get back into those good habits, OCD still makes you do more, right? Because now you're seeking reassurance. Maybe now you are ruminating about why you can't get those things done. You're trying to figure out the pattern of like, why am I so exhausted again, right? And honestly, with an ADHD OCD overlap, oftentimes with ADHD, you just are going to hit these like cycles of like feeling really activated, feeling able to do it. And then these cycles of like lull. Maybe it's because you're not as stimulated. Maybe it's because you've been pushing yourself to be like on top of things 8 hours a day, which is more of like a neurotypical time cycle versus an ADHD is a little bit more of like a 30-day time cycle, right? So what you've done maybe in like the course of 3 hours would be maybe what like a neurotypical person does over the course of a week, right? But then you're like, okay, well, I just got a lot of this stuff done. I should be able to keep producing at that level. And OCD says, well, you got this much done that day. Why can't you get anything done today, right? So, really, what I would say in this situation is if you're having good days, if you're having good techniques, and then you're noticing these lull days, you should be giving yourself a little bit more self compassion, right? Because when we're self punishing ourselves, OCD is going to come in and say, yep, you're right. We are terrible. We can't do anything right. We don't do things properly. Like, and we just have to deal with that. We just have to sit in that and we have to feel really bad about that fact, right? So when that is happening, take a step back, engage in some of that self compassion, right? Recognize, like, okay, maybe today is just an off day. Bother OCD with it, right? Say, well, maybe people will be upset with me that I'm not doing as much. Maybe my boss will be upset I'm not producing as much. Maybe I won't get that assignment completed in the timeline that OCD told me I should do, right? Or ADHD says if I don't do it at this time, then I'm just going to completely forget it. So, really, this might not be exactly how you want to hear it, but engaging in that self compassion is going to be really important at that period of time. And then by doing that, when you have the energy, when you have the ability, then you can get back into those good techniques and re engage with it. A great question.
Nice. Okay. Next question is, how often do people have both OCD and ADHD? And then is it more likely if you have one to have the other? Like if you have ADHD, are you like what are the chances of you having OCD, I guess?
Yeah, totally, totally good question. Um, I believe From the last webinar that we did, the overlap that we see with both ADHD and OCD, comorbidity in other terms, is about 30%, right? So that is like a good chunk. It's a little bit less than a third. And with the rate of people who like actually get diagnosed with both of these things, my assumption would be that it's actually a lot higher, the amount of people who have both of these things, especially because with ADHD, it really can be a seesaw of like, if your ADHD is really high and you're struggling with your ADHD, often what will happen is your anxiety will rise, right? So, for all of the difficulties that you have with ADHD, let's say the time management piece. I have such difficulty with time management. Maybe that looks like difficulty leaving the house, difficulty being on time for things. Okay, because I know I'm going to be late for this, because I know I'm always late for this, anxiety says, well, we really can't be late for this, so we need to leave 3 hours early. I don't care that it takes 30 minutes to get there, right? Like, we need to get there on time. And so, with OCD and anxiety in and of itself being that kind of like seesaw between the two difficulties, right? If we've got OCD on top of that, then it just kind of like lays it on a little bit thicker with that worst case scenario. It's like, we have to leave that 3 hours early, because if we're not on time for this, we're going to get fired, or our friends are going to hate us and they're never going to hang out with us again. And then we're going to be alone forever. And I'll tell you what, if it's between leaving 3 hours early and, not being alone forever and leaving at the proper time of 30 minutes, person with OCD and ADHD is going to probably choose, okay, let me leave 3 hours early then. Or they're going to try to avoid all of that discomfort and say, I can't think about that, end up being late, and then ruminating a lot afterwards about like, are they upset with me? How did that go? Like, am I going to get fired because I was late? And it's just a super fun, super nice cycle between the two of those things.
Thanks for answering that. Okay, next question. Do you have any tips for breaking what I call the guilt loop, which is where you start ruminating on something that makes you feel bad, and then you get frustrated with yourself for that, and it just keeps you feeling stuck and bad?
Yeah, totally. Um, so I want to would what oh good words. What I like to make sure with my clients is, are we looking at guilt or are we looking at shame? And the two are a little bit different in how they present, right? So guilt is, I did something bad. I did something that does not connect with my values. I don't feel very good about that thing that I did. And guilt is great. I mean, it's not like the most fun to feel. It's not the most comfortable, but it does. It connects you with your values. It says, like, okay, fair enough. We didn't love that. Shame, however, shame is not nice and shame is not helpful at all. Shame says, I am XYZ. I am bad. I am a bad person. I am the worst. I am lazy. I am awful. I am horrible, right? So if you're ruminating on something, right, and you're feeling that guilt about ruminating, what I would want to know is, are you feeling guilty? Are you saying like, "Ugh, I can't believe I was ruminating again. Like, I don't feel very good about that. I really want to break the cycle of ruminating. I want to try to resist that ruminating next time." Fair enough. Totally. Heard. Motivating. Telling you that you want to change, telling you you want to do something differently. Or are you saying, oh my God, I am so horrible. I can't believe I went down the rabbit hole again. I can't believe I'm ruminating again. I'm never going to get better. My OCD is always going to stay as bad as it is right now. And I shouldn't even bother trying. Maybe I don't even have OCD. Maybe I am just like a lazy person who is not like bothering with this. Gross. Hate that. Like, that is not helpful dialogue at all, right? Because that keeps you in the black and white thinking. That keeps you in like, you can't do anything. And genuinely, okay, if you can't do anything, why are you going to be mean to yourself about it? I am a lazy person. Okay, period, right? Like, what are you going to do about that? If that is something that is intrinsically you, then there's no reason to feel bad about it, right? But my guess is it's not something that's intrinsically you. You have just been told or taught or learned throughout your life that if you're mean to yourself, that you're actually going to be motivated to change. But generally speaking, I disagree. And what I have seen with people and what actually motivates change, what actually creates behavioral change, is that being mean to yourself, all it does is makes OCD a lot stronger and makes it take a lot more control out of your life, right? So, first things first, I would just try to make sure, are we in guilt or are we in shame? Because guilt we can do something about. Shame, we need to get into guilt to be able to do something about it. And kind of similar to what I was talking about last time, what we would want to look into is like engaging in self-compassion a little bit more, because we are in that guilt cycle. When we are stuck in that, it can be very difficult for us to say like, okay, like let me actually make this change, right? Because it can be very difficult. Usually guilt is accompanied by like self-punishment, right? Um, so engaging in that self-compassion is going to be important. So what I have my members do is like create a self-compassion goal, a self-compassion treatment goal, right? So first we would recognize how you're being critical of yourself, which usually contributes to a lot of negative feelings. And those negative feelings really just keep rumination coming back and coming back and coming back. So trying to not be critical of yourself, trying to not use that negative self-talk, right? And then we would want to look for ways of getting support, right? OCD often tells us a lot of horrible, negative, terrible things. And a lot of those things can be things that we don't want to talk about with other people, that are uncomfortable, that are distressing, right? And OCD isolates you in that way, right? So actually getting support, talking to people, engaging with them, not to get reassurance, right? Because OCD can trick us in that way too, right? But really just to like get that support, get that understanding from other people, so that we can have that self-compassion, right? And then the other thing is developing and implementing like opposite actions. So what are some things that you can do that are self-care, right? What are some nice things for yourself that you can do? And I cannot tell you how many times my clients, especially my ADHD clients, will say, okay, then I'll clean my room. And I'm like, no, that is a nice thing to do. That is a productive thing to do, but that's not self-care, right? Um, if you are being mean to yourself, if you're punishing yourself, if you're saying like, oh, I'm the worst, I'm never going to sit here and tell you, well, have you considered just cleaning your room? That's horrible. That's not nice to you at all, right? So, doing nice things for yourself, doing some like maybe yoga, going on a walk, like doing things like that, not in response to like rumination necessarily, but in response to that self-punishment, that negative self-talk, right? And genuinely looking at the last step, which is like acknowledging how you're going to celebrate your wins, which so many people that I talk to, either who have just OCD or who have OCD and ADHD, are like, oh, I don't celebrate wins. I actually don't have any concept of how I'm supposed to celebrate a win. How do other people celebrate wins? Like, what are other people's ideas? And that's another reason you might get stuck in that guilt and rumination cycle, is because you're not giving yourself any space to feel good when you do accomplish things. You're not giving yourself the space to sit in that positivity of like, wow, it feels really good that I was able to do this, right? And instead, if you're just doing this like self-punishment cycle of like, I have to do this or else. Okay, I completed it. Now I have to do this or else. Okay, now I did that one. And then just keep going through, what's the next task? What's the next accomplishment? What's the next thing I have to do? You're probably always going to be stuck in that because you're not giving yourself any space to feel the accomplishment, feel the nice things. So That would be long term, how I would say it would be helpful to kind of break that rumination guilt loop.
Super interesting. Thanks for that. All right, next question is how to get over the constant debilitating fear and anxiety of the consequences of doing nothing. For instance, fear of how someone will react if I talk to that person about something. And so I never do that task. And then the same thought keeps swirling in my mind. Or the fear and anxiety of filling paperwork at a government office because it's always such a burdensome task and they always make us jump through hoops. And even then, the job does not get done, or fear of someone's rudeness. So I guess the overall question is how to get over the constant debilitating fear and anxiety of the consequences of doing nothing, of doing anything. Yeah.
Yeah, totally. So it sounds like it's this double-edged sword. If you do something, someone could be mad at you. And if you do nothing, someone could be mad at you, right? So what I would say there is what's important to you, right? Like, what do your values say that you should be doing? Are you needing to fill paperwork out at a government office because that's a requirement of you for like political reasons or logistical reasons or like legal reasons, things like that? Okay, that sounds pretty important, right? That sounds like something that you would only do if you had like a value, if you had like a priority there, right? So, yeah, people might get mad at you. People might get mad at you either way, right? Like, so the most important thing is to act in accordance with your values, right? So, avoiding things isn't going to make people less mad at you. Doing things isn't going to make people less mad at you, right? Like, let's say you go into a coffee shop and you're like, hey, like, I would like to order a caramel macchiato, please. Thank you so much. I really appreciate it. They might not care, right? I've just given lots of pleasantries. I've said please, I've said thank you, I've done it in a very nice way. They genuinely might not care. They might still be mad at me because maybe they don't want to be working that day. Maybe they're annoyed that they're working at a coffee shop, right? So I could be super nice and they could be mad at me. Or I could go in and I could say, I need a caramel macchiato. Okay, that's not nice, right? It's not like mean, but it's not like super pleasant. It doesn't have all of the pleasantries of like the pleases, the thank yous, the like regular politeness that we would usually see, right? And they might not care. They genuinely might just be like, okay, amazing. Like, I'm so glad that they didn't give me like a bunch of extra words and a bunch of extra pleasantries because I am about to go on break and I cannot wait. This is the last person I have to take. Amazing, right? So realistically, at any point in time, you people could be mad at you either way, right? So let's say you're avoiding something and then you're feeling really bad about avoiding something. I would say the reason you feel bad about avoiding the thing is because you have to do the thing at some point in time, right? So by avoiding it, you're just going to keep festering in that negativity, right? Because the fear of the negative consequence of like what will happen when I actually do this thing. I would say try to just do the thing. And I know that that sounds a lot easier when I'm saying it. There's a lot of things that are very, very difficult to do. There's a lot of things that the fear, the consequence sounds really great. Me, myself, and I personally hate roller coasters. They are very, very scary for me. Um, I think because like the heights, whatever, I feel like danger, not necessary. Like things could fall apart. I don't love it. It doesn't feel great, right? But recently I went to Universal in Florida and I was like, oh, okay, I'm with someone, and there's is the last time that I want to say it was called the Hollywood Rip Ride Rocket was going to be around. Like it was closing this year, and they were like, oh, I really want to go on this for nostalgia. And I was like, I really don't want to go on this, right? And I watched it like go multiple times. I tried to avoid it as long as possible. But the longer I avoided it, the more I ruminated about it, the more I just watched the roller coaster go up because it spends a good amount of time where you're on your back, just like climbing at 90 degrees. I was like, this isn't making anything better. This is just making me more and more scared, more and more anxious. So eventually I decided, okay, like, let me just rip off the band-aid and get on this roller coaster. And I was scared, right? I was maybe at like a level 8 out of 10 on the distress on the scared scale, right? But I went on, and it actually was not as bad as I expected it to be, because I also reduced another avoidance, which is usually when I'm on a roller coaster, I close my eyes because I really am scared about the feeling and like the look of it as you're falling. But this time I kept my eyes open, and I actually really enjoyed being able to see. Luckily, it was nighttime, so what I could see was mostly like stars and like pretty lights of the theme park. But by reducing my avoidance in two different ways, not that I'm like, oh my God, I love roller coasters now, but I was able to experience it. I was able to have a good time, and I was able to feel good about the fact that I didn't avoid something that I really, at the end of the day, wanted to do, just felt very scared about doing.
Nice, thank you for that.
Yeah.
Okay, next question. How does the ADHD OCD overlap differ between hyperactive type and inattentive type ADHD? And what does treatment look like for each?
Mm, that is a very good question. Um, Honestly, I'm gonna be coming up with an answer a little bit on the spot because I've never thought about how those differences interact. So let's see. OCD with inattentive type, I'm gonna say probably thinking about how inattentive is like, losing attention, forgetting things, making simple mistakes. I would say for that side, it's probably going to be more self doubt on the like friendship, the like ROCD, interpersonal relationships, probably. Because, like, let's say inattention has made it so that like you zoned out during a conversation, and then your friend's like, "Hey, were you listening to me?" And you're like, "Oh, no, I was not listening to you. My bad," right? And then your friend's like, "Ugh," or they're just like, "Okay," like, and then go into it again. OCD is gonna say, they hate you. Like, they like don't want to be your friend anymore. You do this all the time. They're probably sick of hanging out with you because you never listen to them, and like nothing ever like goes well in that kind of way, or like something along those lines. So like the inattention leading to those like social difficulties there, right? Um, and then impacting OCD by telling you those like self-doubt things of like your relationships aren't going well, people don't like you, those kinds of things. Otherwise, I'm trying to think of how inattentive can also probably impact like germs and contamination OCD theme as well, especially through like memory hoarding, right? So let's say you have the inattentive type and you are walking through a hallway at school or something like that, right? And you think to yourself, oh, did I just accidentally touch that wall? I don't remember. I thought I might have felt myself bump into it. I might have touched it. I should go wash my hands because I can't remember if I touched it. And then maybe after you go and wash your hands, you think to yourself, did I already put soap on my hands? Like, I don't recall if I used the soap already. I should probably just wash my hands again to make sure, right? Um, so anything that can like mess with the memory, anything that can mess with like some of those social interactions, I would say that's probably where it comes in. Mm, you know what? Actually, I'm glad that we're asking this question. I'm thinking about so many different ways that it can impact it. Because actually, where I think it could impact it a lot is in also the harm, injury, bad luck category too, especially specifically when it comes to driving, right? So if you have ADHD, or in general, this could happen to you too. Let's say you're driving down the street and you think, I have been driving for a while. I actually do not recall if I have driven through any red lights. I feel like I didn't pass any stoplights, but I kind of zoned out. Maybe I did go through a stoplight. Maybe I'm going to get a traffic ticket. Maybe this is going to cause a lot of problems for me. Maybe I could have accidentally hit someone and I didn't realize it, right? So that's how OCD could impact the inattentive type there. Is like, okay, I zoned out, I forgot. I don't think I did anything like that, but it's a possibility, right? And if OCD gets the inkling of a possibility that you did something wrong, it's absolutely going to attack you on that. And it's going to say, well, we need to solve for that possibility. We need to figure it out. So inattentive, I would say, definitely can impact lots of different areas with that. Um, as far as hyperactive, my first initial thought is how it's going to impact you socially, right? And especially in like a non-remote work setting, right? So let's say you like feel the urge to get up and move around a lot, or with the hyperactivity, you also have a little bit more of that like fidgeting, needing to stimulate kind of thing. That could look like, okay, I'm clicking my pen and I didn't even really realize it because I just like the noise of the clickiness of the pen. And then maybe it looks like your coworker turning over, looking at you, being like, can you stop that? Like that's a little annoying, right? And then OCD can take that and say, yeah, they're all upset with you. You're not just annoying that one person. Actually, probably everyone in the cubicle is upset with you. And not only is everyone in the cubicle upset with you, they probably all talk about you and they don't want you to be here anymore. Probably that's going to affect your boss's perception of you because nobody's going to have good things to say about you. So you can probably expect to be fired at your next review because of this one instance where you were clicking your pen and then your coworker got mad at you, right? Um, Trying to think about the hyperactive, maybe similarly with the germs and contamination, less about the like inattention and forgetfulness, but like let's say hyperactivity, you're feeling the need to move around a lot, feeling the need to do a lot of different things, right? And then in doing all of those things, you just bump into things, you touch different things, and then from there you think to yourself, oh my God, if I touch this, a bunch of other people probably touch this. And it's possible that they could have germs. They could have like it's sick season right now. Maybe they like coughed on this and now I have to go wash my hands. And then, all of those things kind of happening too. Um, I feel like the inattentive, I can think of a little bit more things than the hyperactive. But I think the hyperactive, maybe also with like the just right feeling, the need for things to be like symmetrical or just right, because oftentimes stimulation can just feel like an internal itch, an internal urge to need to stimulate, right? And so when that happens, when it feels like you need to move around, when it feels like you need to do different things, it might also feel like you need to do it in like a just right kind of way. It might feel like, okay, I'm never going to be able to settle. I'm never going to be able to go to sleep. I'm never going to be able to relax until I do this in a just right kind of way. So it might have a little bit of impact there too. So trying to work against that urge and trying to still have the stimulation needs met without it kind of touching in that just right way. And I'm sure that there's honestly many other ways that ADHD and OCD can impact each other in these two different subsets. But I would say those are off the top of my head, like how I would assume it impacts, and honestly, how I've seen a lot of the impact, mostly in the social sense, especially because ADHD also is going to go with some of that like rejection sensitivity dysphoria as well. So that's going to heighten the more interpersonal relationship distress a little bit more.
Thanks for that. That was super interesting.
Yeah.
Okay, this will probably be the last question. Is extreme indecision and anxiety over not being able to make a decision part of ADHD or OCD or both?
Uh, yes. Yes is going to be my broad answer. I would say it would definitely be part of both of these things, right? But similarly, it might show up differently in ADHD than it does in OCD, right? So one thing that's really like, if you take away from this webinar, I would say is that like OCD is very like doubt based. It's very like fear, what if based, right? So if your difficulty, if your anxiety around making a decision is about a doubt, a fear, or a what if, chances are it has something to do with your OCD. Chances are that is what's impacting you a little bit more. With ADHD, it might still look a little bit like that because of like what we said just a second ago with the rejection sensitivity dysphoria, right? Of like difficulty making a decision because what if people are upset with you? What if it's not the right decision? But it also might have to do with like really genuinely not wanting to do things over again, like having just enough energy, just enough motivation to do it the one time, and then feeling extremely exhausted by like, oh my God, did I make the wrong decision? Like, which laundromat should I go to? Well, this is the closest one to me, but maybe it's not, doesn't have the best reviews, right? Like maybe I have to go to a different one. And then from there, the decision fatigue, if it's not stimulating enough, the decision you're trying to make, like the age old question of like, what do you have for dinner? OCD might not impact that, but because there might not be a fear or doubt based part of it, but it might be like, oh God, like none of that sounds good. None of that sounds like something I want to do or something I want to eat or ingest right now. Um, and so I can't make a decision about it because it's just not going to bring me any feeling of like happiness or like comfortability with it, right? So I would say the decision anxiety as well as just like decision fatigue really can kind of go hand in hand with either. And when you've got both OCD and ADHD, it can really be a perfect combination of let me just avoid and not make decisions so that I don't make the wrong decision and so I don't waste precious time and energy on doing the wrong thing.
That was great. Thank you. Yeah, thank you so much, Izzy. Really appreciated that. I thought it was super important and interesting, this whole event. And
Yeah.
one quick thing before we head out of this webinar, I really wanted to make sure that you guys on this webinar knew about this really unique opportunity that's going on at NOCD right now through the end of the month. So you may be struggling right now. You don't really know what's going on. If you have mental compulsions or intrusive thoughts, or just really struggling and need slash want answers, well, we have a great opportunity. So for Mental Health Awareness Month, our clinical experts here at NOCD, including Dr. Patrick McGrath, Tracy Ibrahim, you may see her on Instagram. They're going to be running exclusive free 15-minute one-on-one consultation calls through the end of this month. There's a limited opportunity available, but it's just 15 minutes where you get to talk to them one-on-one in a private setting. And they're not only specialists in OCD, but they're experts in OCD, and they run our treatment protocols. They're dedicated to researching OCD, and they don't typically get to do this, but for Mental Health Awareness Month, they're really passionate about, giving back to the community. So we're going to drop a link in the chat if you're interested. This is a free 15-minute one-on-one consultation call with our OCD experts here at NOCD, and you can ask them questions about how diagnosis works, what treatment looks like, and just what living with OCD might look like. And it's private. Yeah, we're super passionate about it this month, especially for Mental Health Awareness Month. So please, if you're interested and just want some guidance or direction, please feel free to click on the link in the chat and schedule a free call with our OCD experts. And just wanted to make sure everybody here knew about it before the end of the month. So again, thank you guys so much for joining this event. This was recorded and will go out to you later this week. So please feel free to share with anyone. And Izzy, thank you so much for joining us. You were wonderful.
Yay, thanks guys.
All right, talk to you later. Bye.